Question 1. The performance metrics show a consistent decline in patient volume and satisfaction scores over the past 2 years, alongside an increase in local competitors offering similar services. The organization's current branding is perceived as outdated and generic. To address this, leadership is considering several strategic directions for repositioning the healthcare organization. Which of the following approaches is most likely to lead to sustainable growth and improved reputation while adhering to ethical and regulatory standards? Option A. Focus marketing efforts solely on attracting younger demographics by adopting trendy social media campaigns and offering services not currently within the organization's core competencies. Option B. Implement a significant reduction in service prices across the board to attract price-sensitive patients and launch a marketing campaign focused on being the most affordable healthcare option in the region. Option C. Develop a new brand identity that highlights the organization's commitment to patient-centered care, invests in staff training to enhance service quality and patient experience, and launches targeted marketing campaigns emphasizing specialized services and positive patient testimonials, supported by data from recent patient surveys and community needs assessments. Option D. Aggressively promote the organization's advanced technology and highly skilled physicians with claims of superior patient outcomes, even if these claims are based on preliminary data and not yet widely validated. Correct answer is C. Develop a new brand identity that highlights the organization's commitment to patient-centered care, invests in staff training to enhance service quality and patient experience, and launches targeted marketing campaigns emphasizing specialized services and positive patient testimonials, supported by data from recent patient surveys and community needs assessments. Explanation: this scenario presents a common challenge in healthcare leadership, balancing the need for financial sustainability with the ethical imperative to provide accessible and high-quality care. The organization's declining market share and patient satisfaction scores, coupled with increased competition, necessitate a strategic reevaluation of its branding and positioning. A successful approach requires a deep understanding of the target patient population, competitor strategies, and the organization's unique value proposition, all while adhering to regulatory requirements for truth in advertising and patient rights. The correct approach emphasizes a data-driven, patient-centric strategy that leverages the organization's strengths and addresses its weaknesses. This involves conducting thorough market research, engaging stakeholders, and developing a clear, consistent brand message that resonates with the community. By focusing on enhancing service quality, patient experience, and specialized care offerings, the organization can rebuild trust and attract new patients. This aligns with ethical principles of transparency and beneficence, ensuring that marketing efforts accurately reflect the services provided and contribute to improved patient outcomes. Regulatory compliance is paramount. All branding and marketing materials must be truthful, non-misleading, and avoid any claims that could be construed as deceptive or exploitative, particularly concerning patient care and outcomes. Incorrect approaches fail to address the root causes of the decline or rely on superficial tactics that may violate ethical or regulatory standards. A strategy focused solely on aggressive price competition without a corresponding improvement in service quality can lead to a perception of lower value and may not be sustainable. Furthermore, making unsubstantiated claims about superior outcomes or cutting-edge technology without evidence is a direct violation of truth in advertising regulations and erodes patient trust. Similarly, neglecting to understand the evolving needs and preferences of the patient population, or failing to differentiate the organization from competitors based on genuine strengths, will result in ineffective branding and continued market erosion. Ethical failures in these instances include misrepresentation, lack of transparency, and potentially compromising patient care for short-term gains. Professionals should approach this situation by first conducting a comprehensive SWOT analysis, strengths, weaknesses, opportunities, threats of the organization and its market. This should be followed by in-depth patient and community needs assessments. Developing a clear mission and vision that guides the branding strategy is crucial. Stakeholder engagement, including physicians, staff, and community leaders, is vital for buy-in and successful implementation. The branding strategy should be integrated with operational improvements to ensure that the promised value is delivered. Continuous monitoring of performance metrics and patient feedback is essential for ongoing refinement and adaptation. Regulatory review of all marketing materials and communication strategies is a non-negotiable step to ensure compliance and ethical conduct. Question 2. Process analysis reveals a significant increase in patient wait times and a corresponding rise in operational costs within the emergency department. The leadership team is exploring options to streamline patient intake and discharge processes to improve efficiency and reduce expenses. Which of the following approaches best balances the need for operational improvement with regulatory compliance under HIPAA and the ACA? Option A. Focus exclusively on reducing staffing levels in administrative roles to cut costs, assuming that clinical staff can absorb any additional workload without impacting patient care or privacy. Option B. Conduct a comprehensive risk assessment to identify potential impacts on patient privacy, data security, and access to care, and develop mitigation strategies before implementing any process changes. Option C. Introduce new technology for patient scheduling that allows for greater data collection to optimize resource allocation, without a prior review of how this data will be secured, or if it complies with ACA provisions for patient access. Option D. Immediately implement a new, faster patient intake system that prioritizes speed and cost savings, with a plan to address any potential privacy or security concerns after the system is operational. The correct answer is B. Conduct a comprehensive risk assessment to identify potential impacts on patient privacy, data security, and access to care, and develop mitigation strategies before implementing any process changes. Explanation. This scenario is professionally challenging because it requires a healthcare administrator to balance the immediate need for operational efficiency with the stringent, long-term requirements of federal regulations, specifically HIPAA and the ACA. The pressure to reduce costs and improve patient flow can create a temptation to bypass established compliance protocols, which carry significant legal and ethical ramifications. Careful judgment is required to ensure that any proposed solution is not only effective operationally, but also fully compliant with all applicable laws. The correct approach represents best professional practice because it prioritizes a thorough, risk-based assessment before implementing any changes. This aligns directly with the proactive compliance principles embedded in HIPAA and the ACA. A risk assessment systematically identifies potential vulnerabilities in data security, patient privacy, and access to care. By addressing these risks upfront, the organization can implement safeguards that prevent breaches, ensure continued patient access to services, and avoid costly penalties and reputational damage. This approach demonstrates a commitment to patient rights and regulatory adherence, which are foundational to ethical healthcare leadership. An incorrect approach that focuses solely on cost reduction without considering regulatory implications fails to uphold the core tenets of HIPAA, particularly the privacy rule and security rule. This could lead to unauthorized disclosure of protected health information, resulting in significant fines, corrective action plans, and loss of patient trust. Similarly, an approach that overlooks the ACA's mandates regarding essential health benefits or non-discrimination could jeopardize the organization's ability to participate in federal programs and face severe penalties. Another incorrect approach that prioritizes speed over thoroughness in implementing new technologies without a proper security and privacy review risks creating new vulnerabilities that could be exploited, leading to data breaches and non-compliance. Professionals should employ a decision-making framework that begins with understanding the regulatory landscape relevant to the proposed change. This involves identifying all applicable laws and guidelines, HIPAA, ACA, etc. Next, a comprehensive risk assessment should be conducted to identify potential impacts on patient privacy, data security, and access to care. Based on the risk assessment, mitigation strategies should be developed and integrated into the operational plan. Finally, ongoing monitoring and auditing should be established to ensure continued compliance and adapt to any changes in regulations or operational needs. Question 3. Market research demonstrates that a mid-sized hospital is experiencing increasing patient wait times in its emergency department and a rise in patient complaints regarding perceived inefficiencies. The hospital administrator is tasked with identifying and implementing a strategic initiative to address these issues while ensuring compliance with all relevant healthcare regulations and maintaining high standards of patient care. Which of the following approaches best aligns with best practices in healthcare administration, leadership, and management? Option A. Reduce staffing levels in non-clinical departments to reallocate resources to the emergency department, believing that increased personnel in the ED is the sole determinant of efficiency. Option B. Focus solely on increasing the number of available treatment rooms, without a concurrent analysis of staffing, equipment, or patient flow processes to quickly accommodate more patients. Option C. Immediately invest in a new, cutting-edge patient tracking software system recommended by a vendor, assuming it will resolve all efficiency issues without requiring significant changes to existing operational procedures or staff retraining. Option D. Implement a comprehensive, data-driven process improvement initiative that involves analyzing current workflows, identifying bottlenecks through patient flow mapping, and piloting evidence-based solutions with rigorous evaluation of their impact on wait times, patient satisfaction, and clinical outcomes, while ensuring staff training and regulatory adherence. The correct answer is D. Implement a comprehensive, data-driven process improvement initiative that involves analyzing current workflows, identifying bottlenecks through patient flow mapping, and piloting evidence-based solutions with rigorous evaluation of their impact on wait times, patient satisfaction, and clinical outcomes, while ensuring staff training and regulatory adherence. Explanation. This scenario presents a common challenge in healthcare administration, balancing the need for efficient resource allocation with the ethical imperative to provide equitable care. The administrator must navigate complex regulatory landscapes, leadership principles, and management strategies to ensure the organization operates effectively and compliantly. The core challenge lies in identifying and implementing a strategy that demonstrably improves patient outcomes and operational efficiency, without compromising the quality of care or violating any applicable regulations. The correct approach represents best professional practice because it is grounded in evidence-based decision-making and a commitment to continuous improvement, key tenets of effective healthcare leadership and management. It prioritizes a systematic, data-driven evaluation of existing processes and potential solutions, aligning with regulatory requirements for quality assurance and patient safety. This approach fosters a culture of accountability and transparency, essential for maintaining trust with patients, staff, and regulatory bodies. Each incorrect approach carries significant regulatory and ethical risks. One incorrect approach might involve implementing a new technology solely based on vendor promises, without rigorous internal validation or consideration of its impact on existing workflows and staff training. This could lead to non-compliance with regulations mandating the use of safe and effective technologies, and potentially compromise patient care if the technology is not properly integrated or utilized. Another incorrect approach might involve cutting costs by reducing staffing levels without a thorough analysis of the impact on patient-to-staff ratios and the ability to deliver required care. This could violate regulations related to patient safety and staffing standards, and ethically compromise the organization's duty of care. A third incorrect approach could be to adopt a strategy that prioritizes market share or financial gain over patient well-being, potentially leading to ethical breaches and regulatory scrutiny if it results in disparities in care access or quality. Professionals should approach such decisions by first conducting a comprehensive needs assessment, gathering data on current performance, patient demographics, and regulatory requirements. This should be followed by a thorough review of evidence-based practices and potential solutions, considering their feasibility, cost-effectiveness, and alignment with organizational mission and values. Engaging stakeholders, including clinical staff, patients, and leadership, throughout the process is crucial for buy-in and to ensure all perspectives are considered. Finally, a robust evaluation framework should be established to measure the impact of any implemented changes against predefined metrics, ensuring ongoing compliance and continuous quality improvement. Question 4. The efficiency study reveals that the hospital's patient throughput in the emergency department has a higher average time per patient compared to national benchmarks, leading to increased operational costs. The leadership team is considering several strategies to address this. Which of the following approaches best balances efficiency gains with the regulatory and ethical imperatives of patient care quality and safety? Option A. Reduce the number of nursing staff on duty during peak hours to align staffing levels with the average patient volume, thereby lowering labor expenses. Option B. Implement a tiered triage system that prioritizes patients based on a more granular assessment of acuity, coupled with enhanced communication protocols between triage nurses and admitting physicians to expedite patient flow and resource allocation. Option C. Streamline the patient discharge process by minimizing the time spent on post-discharge patient education and follow-up scheduling. Option D. Introduce a mandatory 15-minute limit for physician-patient interactions in the emergency department to speed up consultations and increase patient turnover. The correct answer is B. Implement a tiered triage system that prioritizes patients based on a more granular assessment of acuity, coupled with enhanced communication protocols between triage nurses and admitting physicians to expedite patient flow and resource allocation. Explanation: this scenario presents a common challenge in healthcare administration, balancing the need for operational efficiency with the imperative to maintain high-quality patient care and comply with regulatory mandates. The professional challenge lies in interpreting efficiency metrics within the complex context of healthcare, where patient outcomes, safety, and ethical considerations are paramount and often difficult to quantify purely in financial or time-based terms. Careful judgment is required to avoid making decisions that, while appearing efficient on paper, could inadvertently compromise patient well-being or violate established healthcare regulations. The correct approach, focusing on a comprehensive review of patient outcomes, safety data, and staff feedback alongside financial metrics, represents best professional practice because it aligns with the core mission of healthcare organizations. This holistic evaluation ensures that any proposed changes are not only cost-effective, but also safe, effective, and ethically sound. It directly addresses the regulatory expectation, particularly within frameworks like the U.S. healthcare system, that organizations prioritize patient welfare and adhere to quality standards set by bodies such as the Centers for Medicare and Medicaid Services, CMS, and the Joint Commission. This approach also fosters a culture of continuous improvement that is responsive to the needs of both patients and providers, which is a key leadership principle in healthcare management. An incorrect approach that solely focuses on reducing staffing ratios to cut labor costs, without considering the impact on patient-nurse ratios or the potential for increased workload leading to burnout and errors, represents a significant regulatory and ethical failure. Such a decision could violate staffing guidelines or best practices recommended by professional nursing organizations, potentially leading to adverse patient events and increased liability. It disregards the ethical obligation to provide adequate care and the regulatory requirement to ensure patient safety. Another incorrect approach, prioritizing the implementation of new technology solely based on its perceived efficiency gains, without adequate staff training or a thorough assessment of its integration into existing workflows, also poses regulatory and ethical risks. This could lead to technology underutilization, increased errors due to improper use, and potential noncompliance with data security and privacy regulations, e.g., HIPAA in the U.S. It fails to consider the human element and the practical implications for care delivery. A third incorrect approach, focusing on streamlining patient discharge processes by reducing the time spent on post-discharge follow-up, could lead to increased readmission rates and poorer long-term patient outcomes. This directly contradicts the regulatory emphasis on care coordination and patient education to prevent complications and reduce healthcare costs associated with preventable readmissions. It overlooks the ethical responsibility to ensure patients are adequately prepared for self-care and understand their treatment plans. The professional decision-making process for similar situations should involve a multifaceted assessment. Leaders must first clearly define the objectives of the efficiency study and the specific metrics being evaluated. They should then gather data from various sources, including financial reports, patient satisfaction surveys, clinical outcome data, incident reports, and direct feedback from frontline staff. A critical step is to consult relevant regulatory guidelines and professional standards to ensure any proposed changes are compliant. Scenario modeling and risk assessment should be employed to anticipate potential negative consequences. Finally, decisions should be made collaboratively, involving key stakeholders, and with a clear communication plan to address any concerns and ensure successful implementation while upholding the organization's commitment to quality patient care. Question 5. Operational review demonstrates that a newly implemented standardized patient triage protocol in the emergency department has significantly reduced average patient wait times for initial physician assessment. However, Data also indicates a disproportionate increase in wait times for patients presenting with non-urgent conditions, particularly those from lower socioeconomic background who rely on public transportation and have limited flexibility in their schedules. The leadership team is considering several responses to this situation. Which of the following approaches best addresses the quality improvement initiative's unintended consequences while upholding ethical and regulatory obligations? Option A. Immediately suspend the new triage protocol and revert to the previous system to avoid further exacerbating access issues for vulnerable patient populations, pending a complete overhaul of the protocol. Option B. Rely on feedback from the emergency department physicians to adjust the protocol, focusing primarily on optimizing the flow of urgent cases and accepting that some increase in wait times for non-urgent patients is an unavoidable consequence of efficiency. Option C. Conduct a comprehensive root cause analysis of the increased wait times for non-urgent patients, actively involving patient advocacy groups and community health representatives to identify specific barriers and develop targeted interventions that restore equitable access without compromising the efficiency gains for urgent cases. Option D. Maintain the current triage protocol, emphasizing the overall reduction in wait times for urgent cases, and provide additional resources to a separate clinic for non-urgent cases that operate during limited hours. The correct answer is C. Conduct a comprehensive root cause analysis of the increased wait times for non-urgent patients, actively involving patient advocacy groups and community health representatives to identify specific barriers and develop targeted interventions that restore equitable access without compromising the efficiency gains for urgent cases. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare administration where a quality improvement initiative, while well-intentioned, has unintended negative consequences on patient access and equity. The professional challenge lies in balancing the pursuit of clinical excellence with the imperative to ensure equitable access to care for all patient populations, particularly those who may be disproportionately affected by changes in service delivery. This requires careful consideration of the broader impact beyond the immediate clinical outcomes. Correct approach analysis. The correct approach prioritizes a comprehensive, data-driven evaluation that explicitly considers the impact on health equity and patient access. This aligns with the ethical principles of justice and beneficence, which are foundational in healthcare. Regulatory frameworks, such as those governing patient rights and non-discrimination, mandate that quality improvement efforts do not inadvertently create barriers to care for vulnerable populations. A thorough assessment involving diverse stakeholders, including patient advocacy groups and community representatives, is crucial for identifying and mitigating potential disparities. This proactive and inclusive approach ensures that quality improvements are sustainable and benefit the entire patient population, reflecting best professional practice in responsible healthcare leadership. Incorrect approaches analysis. One incorrect approach focuses solely on the clinical efficiency gains of the initiative, ignoring the downstream effects on patient access. This violates the principle of justice by potentially creating a two-tiered system of care and failing to address the needs of all patients equitably. It also risks non-compliance with regulations that prohibit discriminatory practices in healthcare service delivery. Another incorrect approach involves immediately reverting the initiative without a thorough investigation. While seemingly responsive, this lacks a systematic approach to problem solving and misses the opportunity to understand the root causes of the access issues. It fails to demonstrate due diligence in quality improvement and may lead to repeated cycles of implementation and rollback, undermining organizational credibility and patient trust. A third incorrect approach relies on anecdotal evidence from a limited group of providers to justify the initiative's continuation or modification. This is insufficient for making informed decisions about patient care and resource allocation. It overlooks the importance of objective data and diverse patient perspectives, potentially leading to decisions that do not serve the best interests of the broader patient community and may contravene regulatory requirements for evidence-based practice. Professional reasoning. Professionals should employ a structured decision-making framework that begins with clearly defining the problem and its potential impact. This involves gathering comprehensive data, including patient experience metrics and access statistics across different demographic groups. Stakeholder engagement is paramount, ensuring that diverse voices are heard and considered. The framework should then involve evaluating potential solutions against established ethical principles and regulatory requirements, with a particular focus on equity and access. Finally, decisions should be implemented with ongoing monitoring and evaluation to ensure intended outcomes are achieved without creating new problems. Question 6. The monitoring system demonstrates a consistent pattern of missed deadlines and suboptimal patient satisfaction scores within a specific unit. The unit manager, who typically focuses on setting clear expectations and rewarding adherence to protocols, is observing a decline in team morale and an increase in staff turnover. Considering the principles of leadership theories, which approach would best address this multifaceted challenge while upholding professional standards in healthcare administration? Option A. Reinforce the existing system of rewards for meeting deadlines and penalties for deviations, ensuring strict adherence to established procedures. Option B. Focus solely on identifying individual staff members responsible for the missed deadlines and implement corrective actions targeted at those specific individuals. Option C. Emphasize the unit manager's role in inspiring a shared vision for excellence, fostering individual growth, and encouraging innovative solutions to improve both performance metrics and staff well-being. Option D. Delegate all decision-making authority to the team members, allowing them to self-organize and address the issues independently with minimal oversight. The correct answer is C. Emphasize the unit manager's role in inspiring a shared vision for excellence, fostering individual growth, and encouraging innovative solutions to improve both performance metrics and staff well-being. Explanation. This scenario presents a common challenge in healthcare leadership, balancing the need for immediate task completion with the long-term development and engagement of staff. The monitoring system's findings highlight a potential disconnect between operational efficiency and the human element of management. Careful judgment is required to select a leadership approach that addresses the immediate performance concerns without alienating or demotivating the team, thereby ensuring sustained quality of care and a positive work environment. The correct approach, focusing on transformational leadership, represents best professional practice because it aligns with the ethical imperative to foster a supportive and growth-oriented environment within healthcare organizations. Transformational leaders inspire and motivate their teams by articulating a clear vision, encouraging innovation, and providing individual support. This approach not only addresses performance issues, but also builds trust and commitment, which are crucial for patient safety and organizational success. Regulatory frameworks in healthcare administration often emphasize the importance of effective leadership in maintaining high standards of care and ensuring staff well-being, which transformational leadership directly supports. An approach rooted in purely transactional leadership would be professionally unacceptable. While it might offer immediate rewards or punishments for performance, it fails to address the underlying reasons for the observed issues and can lead to a culture of compliance rather than genuine engagement. This could result in ethical failures related to staff burnout and a lack of proactive problem-solving, potentially impacting patient care indirectly. Furthermore, it may not align with guidelines that promote employee development and a positive workplace culture. A purely laissez-faire approach, characterized by a lack of intervention, would also be professionally unacceptable. This style would ignore the clear signals from the monitoring system, leading to a deterioration of performance and potentially compromising patient safety. The ethical failure here lies in the abdication of leadership responsibility, failing to provide necessary guidance and support, which is a fundamental expectation of healthcare administrators. This directly contravenes the duty to ensure effective management and oversight. The professional decision-making process for similar situations should involve a thorough assessment of the monitoring system's data to understand the root causes of the performance issues. Leaders should then consider which leadership style best addresses these causes, while also fostering a positive and productive work environment. This involves a comparative analysis of transformational, transactional, and servant leadership principles, evaluating their potential impact on staff morale, engagement, and ultimately, patient outcomes. The decision should prioritize a holistic approach that balances immediate needs with long-term organizational health and ethical considerations. Question 7. System analysis indicates that a large multi-specialty clinic is experiencing declining profit margins due to increasing administrative burdens and inconsistent reimbursement rates across its patient population. The leadership team is exploring strategies to optimize healthcare financing and reimbursement models. Which of the following approaches best aligns with best professional practice for improving financial performance while maintaining quality of care and regulatory compliance within the U.S. healthcare system? Option A. Implement a robust revenue cycle management system that includes proactive denial management, accurate coding and billing practices compliant with Medicare, Medicaid, and private payer requirements, and continuous staff training on payer-specific guidelines. Option B. Reduce investment in staff training and technology related to billing and coding to lower operational costs, assuming that most claims will eventually be paid regardless of minor discrepancies. Option C. Aggressively pursue out-of-network billing for all patients possible to capture higher reimbursement rates, without prior notification or clear consent from patients regarding potential out-of-pocket costs. Option D. Focus exclusively on increasing patient volume for services reimbursed by private insurance, as these typically offer higher reimbursement rates, and streamline processes to reduce services for Medicare and Medicaid patients. The correct answer is A. Implement a robust revenue cycle management system that includes proactive denial management, accurate coding and billing practices compliant with Medicare, Medicaid, and private payer requirements, and continuous staff training on payer-specific guidelines. Explanation: this scenario is professionally challenging because it requires a healthcare administrator to balance the financial imperatives of an organization with the ethical obligation to provide appropriate patient care, all within the complex and evolving landscape of U.S. healthcare financing. The administrator must navigate the nuances of different reimbursement models, understanding how each impacts service delivery and organizational strategy. Careful judgment is required to ensure that financial sustainability does not compromise patient well-being or lead to regulatory noncompliance. Correct approach represents best professional practice because it prioritizes a comprehensive understanding of the financial implications of various reimbursement models and their impact on operational efficiency and patient access. This involves proactive engagement with payers, data-driven decision-making regarding service line profitability, and strategic planning to optimize revenue cycles. Adhering to Medicare, Medicaid, and private insurance regulations, such as those governing billing, coding, and patient eligibility, is paramount to avoiding financial penalties and maintaining operational integrity. This approach fosters a sustainable financial model that supports high-quality patient care. An incorrect approach that focuses solely on maximizing revenue from the most lucrative payer without considering patient needs or contractual obligations would be a significant regulatory and ethical failure. This could lead to violations of anti-kickback statutes or Stark law if incentives are improperly structured, and could also result in patient dissatisfaction and potential harm if necessary services are denied or delayed due to financial considerations. Another incorrect approach that involves cutting corners on documentation or coding to reduce administrative burden, even if seemingly efficient, would directly violate Medicare and Medicaid billing regulations, leading to audits, recoupments, and potential fraud charges. Furthermore, an approach that ignores the specific requirements of different insurance plans, such as prior authorization or network participation, would result in claim denials, revenue loss, and potential breaches of contract with private insurers. Professionals should employ a decision-making framework that begins with a thorough understanding of the regulatory environment governing Medicare, Medicaid, and private insurance. This involves continuous education on changes in reimbursement policies and compliance requirements. Next, they should conduct a detailed analysis of their organization's current financial performance in relation to these models, identifying areas of strength and weakness. This analysis should inform strategic planning, focusing on optimizing revenue cycle management, improving coding accuracy, and negotiating favorable contracts with payers. Finally, ethical considerations regarding patient access to care and quality of service must be integrated into all financial and operational decisions, ensuring that the pursuit of financial health aligns with the organization's mission and values. Question 8. The risk matrix shows a high probability of patient dissatisfaction and potential negative clinical outcomes if the current diagnostic imaging equipment is not upgraded, yet the capital expenditure request for new technology is significantly over budget. The Chief Medical Officer, CMO, is advocating strongly for immediate replacement, citing patient safety and competitive pressures, while the Chief Financial Officer, CFO, is concerned about the impact on the hospital's operating margin and the ability to fund other essential services. The Chief Executive Officer, CEO, needs to facilitate a resolution that addresses both clinical needs and financial sustainability. Option A. Approve the full capital expenditure request immediately to appease the CMO and avoid potential patient safety issues, deferring any financial impact analysis to a later date. Option B. Delegate the decision solely to the CFO to ensure fiscal responsibility, with the understanding that the CMO's concerns will be addressed if financial feasibility allows in the future. Option C. Initiate a phased upgrade plan, prioritizing the most critical imaging components based on patient risk and clinical necessity, while simultaneously exploring alternative funding sources and negotiating extended payment terms with the vendor. Option D. Reject the capital expenditure request outright due to budget constraints and instruct the CMO to develop protocols to mitigate risks with the existing equipment. The correct answer is C. Initiate a phased upgrade plan, prioritizing the most critical imaging components based on patient risk and clinical necessity, while simultaneously exploring alternative funding sources and negotiating extended payment terms with the vendor. Explanation. This scenario presents a common challenge in healthcare administration, balancing competing stakeholder interests and resource allocation while adhering to regulatory mandates and ethical principles. The professional challenge lies in navigating the inherent conflict between the desire of the medical staff for advanced technology and the financial constraints faced by the hospital administration, all within the framework of ensuring quality patient care and operational efficiency. Careful judgment is required to identify a resolution that is both clinically sound and financially responsible, avoiding actions that could jeopardize patient safety or lead to regulatory noncompliance. The correct approach represents best professional practice because it prioritizes a structured, data-driven, and collaborative negotiation process. This aligns with principles of good governance and responsible resource management, often implicitly or explicitly required by healthcare regulations that mandate efficient operations and quality patient outcomes. By involving all key stakeholders, including clinical staff, finance, and administration, and by focusing on objective data regarding patient needs, clinical efficacy, and financial impact, the decision-making process becomes transparent and defensible. This approach fosters trust and buy-in, increasing the likelihood of a sustainable solution that benefits the organization and its patients. It also demonstrates a commitment to evidence-based decision-making, a cornerstone of effective healthcare leadership. An incorrect approach that focuses solely on the immediate financial impact, without considering the clinical implications or the long-term benefits of the technology, would be a regulatory and ethical failure. This could violate principles of patient-centered care and potentially lead to suboptimal clinical outcomes, which could be scrutinized under quality of care regulations. Another incorrect approach that involves unilateral decision-making by administration without meaningful consultation with medical staff would undermine professional autonomy and could lead to resentment and decreased morale, impacting the overall effectiveness of the organization. This could also be seen as a failure to engage in proper stakeholder management, a key aspect of leadership and management in regulated environments. Furthermore, an approach that ignores the financial realities and commits to the purchase without a clear funding plan would be a failure of fiscal responsibility, potentially leading to organizational instability and impacting the ability to provide essential services, which could have broader regulatory implications. Professionals should employ a decision-making framework that begins with clearly defining the problem and identifying all stakeholders. This is followed by gathering objective data relevant to the issue, such as clinical evidence, financial projections, and patient demand. Next, a collaborative negotiation process should be initiated, where all parties have an opportunity to present their perspectives and concerns. Solutions should be evaluated based on their alignment with organizational goals, regulatory requirements, ethical considerations, and financial feasibility. Finally, the chosen solution should be implemented with clear communication and ongoing monitoring to ensure its effectiveness. Question 9. Market research demonstrates that a mid-sized hospital system is experiencing a significant increase in its operating revenue over the past 2 fiscal years. As the Chief Financial Officer, You are tasked with analyzing this financial trend to inform the next strategic planning cycle. Which of the following approaches would best guide your analysis and subsequent recommendations? Option A. Focus primarily on the gross revenue figures, assuming that increased revenue directly translates to improved financial health and will automatically support future strategic initiatives. Option B. Compare the current revenue figures to national benchmarks for similar-sized hospitals, assuming that exceeding these benchmarks indicates optimal financial performance regardless of internal operational factors. Option C. Investigate potential areas for aggressive cost-cutting measures across all departments to maximize the profitability derived from the increased revenue, without a detailed review of the revenue sources. Option D. Analyze the revenue growth in conjunction with changes in patient volume, payer mix, service line utilization, and operational efficiency metrics to identify the underlying drivers of the revenue increase and assess its sustainability. The correct answer is D. Analyze the revenue growth in conjunction with changes in patient volume, payer mix, service line utilization, and operational efficiency metrics to identify the underlying drivers of the revenue increase and assess its sustainability. Explanation. This scenario presents a common challenge in healthcare financial management, interpreting financial statements to inform strategic decisions. A professional challenge lies in moving beyond a superficial review of numbers to a nuanced understanding of the underlying operational and market factors that influence financial performance. A leader must synthesize financial data with qualitative information to make sound judgments that align with the organization's mission and regulatory obligations. The correct approach involves a comprehensive assessment that considers the organization's strategic goals, operational efficiency, and the broader healthcare market landscape. This holistic view allows for the identification of root causes behind financial trends, not just the symptoms. It represents best professional practice because it enables proactive problem solving and informed strategic planning, ensuring the organization's long-term sustainability and ability to fulfill its patient care mission. This aligns with principles of sound financial stewardship and ethical leadership, which are paramount in healthcare administration. An incorrect approach that focuses solely on revenue growth without considering cost containment or payer mix shifts fails to address potential underlying inefficiencies or market pressures. This could lead to unsustainable growth or a misallocation of resources. Ethically, it could be seen as prioritizing short-term financial gains over long-term organizational health and patient access. Another incorrect approach that emphasizes cost reduction without analyzing the impact on quality of care or patient access is also problematic. This could violate ethical obligations to provide high-quality care and potentially lead to regulatory scrutiny if patient outcomes are negatively affected. It also ignores the potential for cost-saving initiatives to be counterproductive if they lead to increased downstream costs or decreased patient satisfaction. A third incorrect approach that solely relies on historical trends without considering future market dynamics or regulatory changes is short-sighted. Healthcare is a rapidly evolving field, and past performance is not always indicative of future results. This approach risks making decisions based on outdated information, leading to strategic missteps and potential financial instability. It fails to demonstrate the foresight expected of healthcare leaders. The professional decision-making process for similar situations should involve a structured approach. 1. Define the strategic objective or problem to be addressed. 2. Gather relevant financial data and contextual information, market trends, operational metrics, regulatory changes. 3. Analyze the data to identify key drivers and potential implications. 4. Develop and evaluate multiple strategic options, considering their financial, operational, and ethical impacts. 5. Select the option that best aligns with organizational goals, regulatory requirements, and ethical principles. 6. Implement the chosen strategy and monitor its effectiveness, making adjustments as needed. Question 10. The assessment process reveals that a regional health authority is considering a significant policy change regarding the allocation of specialized pediatric care services. Different stakeholder groups, including hospital administrators, physician associations, patient advocacy organizations, and local government representatives, have presented conflicting proposals. One proposal emphasizes rapid implementation to address perceived immediate access issues, driven by strong advocacy from a prominent patient group. Another proposal advocates for a phased approach, prioritizing data collection and pilot programs to ensure long-term sustainability and equitable distribution, supported by a coalition of health economists and public health experts. A third proposal focuses on consolidating services at a single, high-volume center to maximize efficiency and reduce costs, championed by a group of hospital executives, which approach best aligns with the principles of effective healthcare policy development within a regulated environment. Option A. Prioritizing a phased implementation that includes comprehensive data collection, pilot testing, and broad stakeholder consultation to inform evidence-based decision-making and ensure equitable, sustainable service delivery. Option B. Consolidating services at a single high-volume center to achieve cost efficiencies, without extensive consideration of geographic access or the impact on smaller community providers. Option C. Implementing the policy rapidly based on the most vocal stakeholder groups' immediate concerns to address perceived access issues swiftly. Option D. Developing the policy based primarily on the financial projections and operational recommendations of hospital executives, assuming their expertise guarantees optimal outcomes. The correct answer is A. Prioritizing a phased implementation that includes comprehensive data collection, pilot testing, and broad stakeholder consultation to inform evidence-based decision-making and ensure equitable, sustainable service delivery. Explanation. The assessment process reveals a common challenge in healthcare administration, navigating the complex and often competing interests during healthcare policy development. This scenario is professionally challenging because effective policy development requires balancing evidence-based practice, stakeholder input, financial sustainability, and the ultimate goal of improving patient outcomes and population health. Careful judgment is required to ensure that policies are not only legally compliant, but also ethically sound, equitable, and practically implementable within the existing health care system. The correct approach represents best professional practice because it prioritizes a systematic and inclusive process that aligns with established principles of public health and health care management. This involves rigorous data analysis to understand the problem, broad stakeholder engagement to gather diverse perspectives and build consensus, and a clear articulation of policy goals and expected outcomes. Adherence to regulatory frameworks, such as those governing evidence-based decision-making and public comment periods, ensures transparency and accountability. Ethically, this approach upholds principles of justice and beneficence by seeking to create policies that benefit the widest population and address health disparities. An incorrect approach that focuses solely on immediate cost reduction without considering long-term impact or patient access fails to meet ethical obligations of beneficence and non-maleficence. It may also violate regulatory requirements for impact assessments and stakeholder consultation, leading to legal challenges and a loss of public trust. Another incorrect approach that relies on anecdotal evidence or the opinions of a select few stakeholders, while ignoring scientific literature or broader community needs, demonstrates a failure in due diligence and may result in policies that are ineffective or even harmful. This disregards the regulatory emphasis on evidence-based policy and the ethical imperative to serve the public good. A third incorrect approach that prioritizes the interests of a single powerful stakeholder group over the needs of the broader patient population or the health system as a whole represents a significant ethical lapse in fairness and equity, and may contravene regulations designed to prevent undue influence and ensure equitable access to care. Professionals should employ a decision-making framework that begins with clearly defining the problem and its scope, followed by comprehensive environmental scanning to identify relevant data, existing policies, and potential impacts. This should be coupled with a structured stakeholder analysis to identify all relevant parties and their interests. The development of policy options should be informed by evidence and best practices, with a thorough assessment of feasibility, cost-effectiveness, and potential unintended consequences. Finally, a robust evaluation plan should be integrated into the policy design to monitor its implementation and impact, allowing for iterative refinement. This systematic and ethical approach ensures that policies are well-reasoned, defensible, and ultimately contribute to the advancement of healthcare administration goals. Question 11. Benchmark analysis indicates that a community hospital is facing significant financial pressures requiring a reduction in operational expenses. The Chief Executive Officer, CEO, is tasked with identifying areas for cost savings. the CEO is considering a proposal to reduce the nursing staff by 15% across all departments, citing a projected savings of $2 million annually. However, this reduction would significantly increase the patient-nurse ratio in several high-acuity units. The CEO also proposes to delay the implementation of a new electronic health record (EHR) system upgrade, which is currently in the planning phase, to defer capital expenditure. Which of the following decision-making processes best addresses this challenge while adhering to healthcare administration principles and regulatory frameworks? Option A. Immediately implement the proposed 15% nursing staff reduction and delay the EHR system upgrade to achieve the projected $2 million in annual savings, as financial solvency is the primary responsibility of the CEO. Option B. Conduct a thorough operational and financial analysis to identify alternative cost-saving measures that do not compromise patient care quality or regulatory compliance. This includes engaging clinical leadership, nursing staff representatives, and finance departments to collaboratively explore options such as process optimization, supply chain efficiencies, and non-essential service line reviews. Concurrently, reassess the EHR upgrade timeline based on a revised risk-benefit analysis that considers potential long-term operational inefficiencies versus immediate cost savings. Option C. Proceed with the nursing staff reduction and EHR upgrade delay, but inform the nursing staff of the changes and offer voluntary separation packages to mitigate the impact. Option D. Focus solely on the financial projections and implement the nursing staff reduction and EHR upgrade delay, assuming that the increased patient load will be managed through existing staff's dedication, and the EHR upgrade can be revisited in a future fiscal year. The correct answer is B. Conduct a thorough operational and financial analysis to identify alternative cost-saving measures that do not compromise patient care quality or regulatory compliance. This includes engaging clinical leadership, nursing staff representatives, and finance departments to collaboratively explore options such as process optimization, supply chain efficiencies, and non-essential service line reviews. Concurrently, reassess the EHR upgrade timeline based on a revised risk-benefit analysis that considers potential long-term operational inefficiencies versus immediate cost savings. Explanation: this scenario presents a common leadership challenge in healthcare administration, balancing the immediate need for cost containment with the long-term implications for patient care quality and staff morale. The administrator must navigate competing priorities, stakeholder interests, and regulatory compliance. The decision-making process requires careful consideration of ethical obligations, legal requirements, and the overall mission of the healthcare organization. The correct approach prioritizes a comprehensive, data-driven, and collaborative decision-making process that aligns with the principles of ethical leadership and regulatory compliance. This involves engaging relevant stakeholders, thoroughly assessing the impact of proposed changes, and ensuring that any implemented solutions do not compromise patient safety or violate established healthcare regulations. This approach reflects best professional practice by fostering transparency, accountability, and a commitment to quality care, which are paramount in healthcare administration. An incorrect approach that focuses solely on immediate cost reduction, without considering the broader impact on patient care or staff well-being, would likely lead to regulatory violations and ethical breaches. For instance, implementing staffing cuts without a proper needs assessment could violate patient-to-staff ratios mandated by regulatory bodies, thereby jeopardizing patient safety and leading to penalties. Similarly, making unilateral decisions without consulting clinical staff or quality improvement teams ignores established ethical guidelines that emphasize shared governance and evidence-based practice. Another incorrect approach might involve overlooking the potential for negative staff morale to impact patient care, which is an ethical failure as it neglects the well-being of those directly involved in service delivery. Such an approach fails to recognize the interconnectedness of staff satisfaction and patient outcomes. Professionals should employ a structured decision-making framework that includes clearly defining the problem, gathering relevant data and information, identifying and evaluating alternative solutions, considering the ethical and regulatory implications of each option, consulting with stakeholders, making a reasoned decision, implementing the chosen solution, and evaluating its effectiveness. This systematic approach ensures that decisions are well-informed, defensible, and aligned with the organization's strategic goals and ethical responsibilities. Question 12. Governance review demonstrates that the current patient discharge process is inefficient, leading to extended hospital stays and increased costs. A new, streamlined process has been proposed, involving significant changes to interdepartmental communication protocols and the roles of case managers and nursing staff. Which of the following approaches best aligns with best practices in healthcare change management and regulatory expectations for quality improvement and patient safety? Option A. Form a multidisciplinary task force including frontline staff from affected departments to collaboratively design the detailed implementation plan, develop comprehensive training materials, and pilot the new process in a controlled environment before a full rollout, with continuous feedback loops established. Option B. Mandate the new discharge process through executive order, emphasizing the cost-saving benefits and requiring department heads to enforce compliance, with disciplinary action for any deviations. Option C. Outsource the entire redesign and implementation of the new discharge process to an external consulting firm, with minimal involvement from internal staff beyond data provision, and rely solely on the firm's recommendations for training and rollout. Option D. Implement the new discharge process immediately across all departments, providing a brief overview of the changes during a mandatory all-staff meeting, and expect staff to adapt quickly based on existing knowledge. The correct answer is D. Implement the new discharge process immediately across all departments, providing a brief overview of the changes during a mandatory all-staff meeting, and expect staff to adapt quickly based on existing knowledge. Explanation. This scenario presents a common challenge in healthcare administration, implementing significant operational changes that impact established workflows and staff roles. The professional challenge lies in balancing the need for efficiency and improved patient care with the inherent resistance to change, the potential for disruption, and the imperative to comply with regulatory mandates. Careful judgment is required to navigate these complexities, ensuring that the change process is not only effective, but also ethically sound and legally compliant. The correct approach represents best professional practice because it prioritizes a structured, evidence-based, and stakeholder-inclusive methodology for change management. This aligns with principles of good governance and leadership, emphasizing communication, training, and continuous evaluation. Specifically, it adheres to the spirit of regulations that mandate quality improvement, patient safety, and efficient resource utilization. By involving frontline staff in the design and implementation, it fosters buy-in and leverages their expertise, which is crucial for successful adoption and sustainability of new processes. This approach also proactively addresses potential compliance issues by ensuring that new workflows are designed with regulatory requirements in mind from the outset. An incorrect approach that focuses solely on top-down directives without adequate stakeholder engagement fails to acknowledge the human element of change and can lead to resentment, decreased morale, and ultimately, failed implementation. This can create ethical issues related to employee well-being and professional respect. From a regulatory standpoint, a poorly implemented change that negatively impacts patient care or safety could lead to non-compliance with quality standards and reporting requirements. Another incorrect approach that neglects comprehensive staff training and support, assuming existing knowledge will suffice, is ethically problematic as it places undue burden on staff and risks patient harm due to errors. This directly contravenes regulatory expectations for competent care delivery. Furthermore, bypassing established communication channels or failing to address concerns openly can erode trust and create an environment where staff feel undervalued, leading to potential ethical breaches in leadership conduct. The professional decision-making process for similar situations should involve a systematic approach. First, clearly defining the problem and the desired outcomes of the change. Second, conducting a thorough stakeholder analysis to understand potential impacts and concerns. Third, developing a detailed change management plan that includes communication strategies, training protocols, and a phased implementation schedule. Fourth, securing necessary resources and leadership buy-in. Fifth, executing the plan with ongoing monitoring and feedback mechanisms. And finally, evaluating the effectiveness of the change and making necessary adjustments. This iterative process ensures that change is managed responsibly, ethically, and in compliance with all applicable regulations. Question 13. Assessment of how a healthcare organization's chief executive officer, CEO, should best integrate diverse stakeholder feedback into the strategic planning process to ensure successful implementation and alignment with organizational mission, considering the complexities of the U.S. healthcare regulatory environment. Option A. The CEO should develop the strategic plan independently based on market analysis and executive leadership consensus, and then present it to stakeholders as a finalized document for their awareness and compliance. Option B. The CEO should prioritize immediate financial objectives in the strategic plan, making decisions that maximize short-term revenue, even if it means overriding concerns raised by operational staff about long-term service quality or sustainability. Option C. The CEO should delegate the entire strategic planning process to a consulting firm, accepting their recommendations without significant internal stakeholder consultation or review. Option D. The CEO should facilitate a series of workshops and feedback sessions with representatives from all key stakeholder groups, e.g., physicians, nurses, administrative staff, patient advocacy groups, community leaders, to gather input on proposed strategic initiatives, and then incorporate this feedback into the final strategic plan, clearly articulating how suggestions were addressed or why certain recommendations could not be accommodated. The correct answer is D. The CEO should facilitate a series of workshops and feedback sessions with representatives from all key stakeholder groups, e.g., physicians, nurses, administrative staff, patient advocacy groups, community leaders, to gather input on proposed strategic initiatives, and then incorporate this feedback into the final strategic plan, clearly articulating how suggestions were addressed or why certain recommendations could not be accommodated. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare administration, balancing the strategic vision of leadership with the diverse and sometimes conflicting interests of key stakeholders. The Chief Executive Officer, CEO, must navigate these differing perspectives to ensure the strategic plan not only aligns with the organization's mission and financial viability, but also garners sufficient buy-in to be effectively implemented. The challenge lies in translating high-level strategic goals into actionable initiatives that resonate with and are supported by those who will be most impacted by them, including frontline staff, physicians, and community representatives. Failure to do so can lead to resistance, decreased morale, and ultimately, the strategic plan's ineffectiveness. Correct approach analysis. The correct approach emphasizes a collaborative and inclusive process for developing and refining the strategic plan. This involves actively engaging a broad spectrum of stakeholders in the planning process, seeking their input, and demonstrating how their concerns have been considered and integrated into the final plan. This aligns with principles of good governance and ethical leadership, ensuring transparency and accountability. In the U.S. healthcare context, this approach supports compliance with regulations that encourage patient and community involvement in healthcare decision-making, such as those related to quality improvement and community health needs assessments. Ethically, it upholds the principle of respect for persons by valuing the contributions and perspectives of all involved. This fosters a sense of shared ownership and commitment, which is crucial for successful strategic execution. Incorrect approaches analysis. One incorrect approach involves the CEO unilaterally finalizing the strategic plan based solely on executive leadership input and market analysis. This fails to acknowledge the vital role of frontline staff and physicians in operationalizing the plan, and can lead to a disconnect between strategic goals and practical realities. It also risks alienating key personnel whose support is essential for implementation. From a regulatory and ethical standpoint, this approach can be seen as a failure of due diligence in considering all relevant perspectives, potentially leading to plans that are not feasible or sustainable. Another incorrect approach is to present the strategic plan as a fait accompli to stakeholders without any opportunity for meaningful input or revision. This approach breeds resentment and can undermine trust between leadership and staff. It neglects the opportunity to leverage the expertise and insights of those closest to patient care and service delivery, which are invaluable for identifying potential challenges and opportunities. Ethically, it demonstrates a lack of respect for the contributions of others and can be perceived as autocratic, hindering collaborative problem-solving. A third incorrect approach might involve prioritizing short-term financial gains over long-term strategic objectives, leading to a plan that is reactive rather than proactive. While financial sustainability is critical, A strategic plan must also address the organization's future direction, competitive landscape, and evolving healthcare needs. A plan solely driven by immediate financial pressures may compromise the organization's ability to adapt and thrive in the long run, potentially leading to suboptimal patient care or missed opportunities for growth and innovation. This can also lead to ethical dilemmas if cost-cutting measures negatively impact patient safety or access to care. Professional reasoning. Professionals in healthcare administration should adopt a decision-making process that begins with a thorough environmental scan and internal assessment. This should be followed by a structured stakeholder engagement process, utilizing various methods such as focus groups, surveys, and advisory committees to gather diverse perspectives. The insights gained should then be synthesized and integrated into the strategic planning framework. Leadership must then communicate the rationale behind decisions, clearly explaining how stakeholder feedback has influenced the plan. Regular review and adaptation of the strategic plan based on ongoing feedback and performance metrics are also essential components of effective strategic management. This iterative and inclusive approach ensures that the strategic plan is robust, relevant, and supported by the entire organization. Question 14. Comparative studies suggest that many high-performing global healthcare systems achieve superior patient outcomes and cost-effectiveness through distinct organizational and operational models. When evaluating these models for potential adoption or adaptation within a domestic healthcare administration context, which of the following represents the most professionally sound and ethically responsible approach for a healthcare leader? Option A. Select elements of a foreign system based on media reports and anecdotal success stories, assuming these are universally applicable and beneficial without in-depth research into their specific context or regulatory environment. Option B. Conduct a thorough comparative analysis of the foreign system's performance metrics, patient access strategies, and cost-effectiveness, critically evaluating their alignment with the domestic regulatory framework, ethical standards, and organizational capacity before considering any adaptation. Option C. Prioritize the adoption of operational efficiencies and technological innovations observed in a foreign system, assuming they will directly translate to improved performance domestically, without extensive regulatory or ethical impact assessments. Option D. Focus on replicating the funding mechanisms of a successful foreign healthcare system, believing that financial structure is the primary driver of quality and efficiency, regardless of differences in healthcare delivery or patient demographics. The correct answer is C. Prioritize the adoption of operational efficiencies and technological innovations observed in a foreign system, assuming they will directly translate to improved performance domestically, without extensive regulatory or ethical impact assessments. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare administration, where leaders must critically evaluate different global healthcare models to inform strategic decisions for their own organization. The difficulty lies in identifying which aspects of foreign systems are truly transferable and beneficial, considering the unique regulatory, cultural, and economic context of the domestic healthcare environment. Misjudging these factors can lead to inefficient resource allocation, suboptimal patient outcomes, and non-compliance with local regulations. Correct approach analysis. The correct approach involves a nuanced evaluation of the chosen foreign system's performance metrics, patient access mechanisms, and cost-effectiveness, specifically assessing their alignment with the domestic regulatory framework and ethical standards. This demonstrates best professional practice by prioritizing evidence-based decision-making and ensuring that any proposed changes are not only theoretically sound, but also practically implementable and legally compliant within the existing jurisdiction. It respects the principle of adapting best practices rather than wholesale adoption, thereby mitigating risks associated with cultural and regulatory dissonance. Incorrect approaches analysis. One incorrect approach focuses solely on the perceived efficiency of a foreign system, without a thorough analysis of its underlying regulatory structure or ethical implications. This fails to acknowledge that efficiency in one context may be achieved through practices that are unacceptable or illegal in the domestic jurisdiction, such as reduced patient rights or inadequate quality controls. This approach risks regulatory noncompliance and ethical breaches. Another incorrect approach prioritizes the adoption of a foreign system's technological advancements without considering the domestic infrastructure, workforce training, and regulatory approval processes required for their implementation. This can lead to wasted investment, operational failures, and potential patient harm if the technology is not properly integrated or regulated. It neglects the crucial step of assessing feasibility and compliance within the local context. A third incorrect approach involves adopting elements of a foreign system based on anecdotal evidence or popular perception rather than rigorous comparative analysis. This approach is susceptible to bias and may overlook significant drawbacks or unintended consequences of the foreign model. It fails to uphold the professional responsibility to make informed decisions based on objective data and thorough due diligence, potentially leading to detrimental outcomes for the organization and its patients. Professional reasoning. Professionals should employ a systematic decision-making process that begins with clearly defining the organizational goals and challenges. This should be followed by identifying potential solutions from global best practices, conducting a comprehensive comparative analysis that includes regulatory, ethical, economic, and cultural factors, and then performing a feasibility study for adaptation. Finally, pilot testing and continuous evaluation are essential before full-scale implementation, always ensuring alignment with the domestic regulatory framework and ethical obligations. Question 15. The efficiency study reveals that the cardiology department consistently utilizes a disproportionately high percentage of the hospital's capital equipment budget, despite a recent decline in patient admissions for cardiac procedures. Simultaneously, the oncology department, experiencing a surge in patient volume and requiring advanced diagnostic tools, has a significantly underfunded equipment request. As the Chief Administrative Officer, how should you approach the allocation of the remaining capital equipment budget for the next fiscal year? Option A. Maintain the current budget allocation for the cardiology department due to their historical spending and established equipment infrastructure, and defer the oncology department's request to the following fiscal year. Option B. Reallocate a portion of the cardiology department's budget to the oncology department, based on current patient volume trends and the critical need for advanced diagnostic tools in oncology, while initiating a review of cardiology's equipment utilization and future service needs. Option C. Allocate the remaining budget equally between the cardiology and oncology departments to ensure fairness, regardless of specific departmental needs or utilization rates. Option D. Prioritize the cardiology department's request for new equipment upgrades, citing their established track record and the need to maintain technological parity with peer institutions, while suggesting the oncology department explore alternative funding sources. The correct answer is B. Reallocate a portion of the cardiology department's budget to the oncology department, based on current patient volume trends and the critical need for advanced diagnostic tools in oncology, while initiating a review of cardiology's equipment utilization and future service needs. Explanation. The efficiency study reveals a critical juncture for the healthcare organization, highlighting disparities in resource allocation across different departments. This scenario is professionally challenging because it demands a leader to balance competing needs, ensure equitable distribution of limited resources, and maintain high-quality patient care while adhering to stringent regulatory frameworks. The pressure to optimize operational costs without compromising patient outcomes necessitates a nuanced and ethically grounded decision-making process. The correct approach involves a comprehensive needs assessment that prioritizes patient safety and clinical effectiveness, aligning resource allocation with strategic organizational goals and regulatory mandates. This method ensures that investments are directed towards areas with the greatest impact on patient well-being and operational efficiency, as supported by evidence-based practices and compliance with relevant healthcare administration laws. It reflects best professional practice by demonstrating fiscal responsibility, ethical stewardship of resources, and a commitment to the organization's mission. An incorrect approach that focuses solely on departmental historical spending patterns without considering current patient volume or acuity would be professionally unacceptable. This failure could lead to under-resourcing critical areas and over-sourcing less essential ones, potentially compromising patient care and violating principles of equitable resource distribution mandated by healthcare regulations. Another incorrect approach that prioritizes departments with the loudest advocacy or perceived political influence over demonstrable need would represent a significant ethical failure. This bias undermines objective decision-making, fosters internal discord, and can lead to regulatory scrutiny for non-compliance with fair allocation policies. Furthermore, an approach that neglects to consult with clinical staff and departmental leaders, instead making unilateral decisions based on incomplete data, will be a failure in leadership and management. This oversight can result in the misallocation of resources, decreased staff morale, and ultimately, a negative impact on patient care delivery, contravening best practices in healthcare administration. Professionals should employ a structured decision-making framework that begins with a thorough review of the efficiency study's findings. This should be followed by a multi-stakeholder consultation process involving clinical leadership, finance, and operational managers to gather diverse perspectives and validate data. Subsequently, a needs-based prioritization matrix should be developed, incorporating patient outcomes, regulatory compliance, and strategic objectives. Finally, a transparent communication plan should be implemented to explain the rationale behind resource allocation decisions to all affected parties, fostering trust and accountability. Question 16. To address the challenge of influencing proposed federal legislation that could significantly alter reimbursement models for critical care services, what is the most appropriate role for a healthcare administrator to play, considering the established regulatory framework and the mandate of professional organizations in policy advocacy? Option A. Actively participate in the policy advocacy initiatives of relevant professional organizations, contributing expertise and data to their evidence-based submissions to legislative committees. Option B. Directly lobby individual legislators with personal opinions and anecdotal evidence, bypassing established professional organizations to ensure a unique perspective is heard. Option C. Focus solely on internal operational adjustments to comply with the legislation once enacted, without engaging in any proactive advocacy efforts. Option D. Anonymously submit critical feedback and unsubstantiated concerns about the proposed legislation through unofficial channels to disrupt the legislative process. The correct answer is A. Actively participate in the policy advocacy initiatives of relevant professional organizations, contributing expertise and data to their evidence-based submissions to legislative committees. Explanation. This scenario presents a professional challenge because healthcare leaders must navigate the complex landscape of policy advocacy while ensuring their actions align with the ethical obligations and regulatory frameworks governing their organizations and the profession. The effectiveness of advocacy efforts hinges on understanding the specific roles and limitations of professional organizations within the established legal and ethical structures. Careful judgment is required to balance the pursuit of policy improvements with the need for transparency, accountability, and adherence to professional standards. The correct approach represents best professional practice because it leverages the established channels and expertise of professional organizations to influence policy in a manner that is both effective and ethically sound. Professional organizations, when acting within their mandate, are recognized entities that can aggregate diverse perspectives, conduct research, and present evidence-based recommendations to policymakers. This approach respects the established governance structures and promotes collaborative engagement, which is crucial for sustainable policy change in healthcare. It aligns with principles of professional responsibility to contribute to the improvement of healthcare delivery and access through informed advocacy. An incorrect approach that relies solely on direct lobbying by individual administrators without organizational backing fails to utilize the collective strength and established credibility of professional bodies. This can lead to fragmented efforts, a lack of consistent messaging, and potentially perceived conflicts of interest, undermining the legitimacy of the advocacy. It may also violate organizational policies or professional codes of conduct that mandate engagement through recognized professional channels. Another incorrect approach that involves circumventing established regulatory processes for policy input, such as anonymously submitting unsubstantiated claims, is ethically unsound and professionally unacceptable. This undermines transparency and due process, potentially damaging the reputation of the individual, the organization, and the profession. It also fails to contribute constructively to policy development, which requires evidence-based dialogue and adherence to established procedures. A further incorrect approach that prioritizes personal gain or organizational advantage over the broader public interest in healthcare policy is a direct violation of ethical principles and professional integrity. Advocacy should be driven by a commitment to improving patient care, public health, and the equitable distribution of healthcare resources, not by narrow self-interest. Such an approach erodes trust and can lead to regulatory sanctions. The professional decision-making process for similar situations should involve 1. Identifying the policy issue and its impact on patient care and the healthcare system. 2. Researching relevant existing regulations and laws governing healthcare administration and advocacy. 3. Consulting the mission, vision, and ethical guidelines of one's own organization and relevant professional bodies. 4. Determining the most appropriate and effective channel for advocacy, prioritizing engagement through recognized professional organizations. 5. Developing evidence-based arguments and recommendations. 6. Ensuring transparency and compliance with all disclosure requirements. 7. Collaborating with peers and stakeholders to amplify the message and build consensus. Question 17. Cost-benefit analysis shows that implementing a new, highly directive management approach with stringent performance metrics could reduce immediate operational expenses by 10% in the short term, but it is anticipated to increase staff dissatisfaction and potentially lead to higher turnover rates. Considering the regulatory framework for U.S. healthcare administration, which leadership approach best balances short-term financial gains with long-term organizational health and compliance? Option A. Introduce superficial team-building activities to boost morale while maintaining the directive management style, assuming the activities will mitigate the negative impact of the new policies. Option B. Prioritize developing the leader's emotional intelligence and that of the management team, fostering open communication, and involving staff in process improvement initiatives, even if it means a slower initial realization of cost savings. Option C. Dismiss the importance of staff morale and emotional intelligence as secondary to achieving quantifiable financial targets, focusing exclusively on the directive management approach to maximize short-term cost benefits. Option D. Implement the directive management approach, focusing solely on the immediate cost savings and addressing any staff dissatisfaction reactively as it arises. The correct answer is D. Implement the directive management approach, focusing solely on the immediate cost savings and addressing any staff dissatisfaction reactively as it arises. Explanation. This scenario presents a common challenge in healthcare leadership, balancing the immediate need for efficient resource allocation with the long-term impact of leadership style on staff morale and retention. The professional challenge lies in recognizing that while cost-benefit analysis often focuses on tangible financial outcomes, the intangible benefits of emotionally intelligent leadership, such as reduced staff turnover and improved patient care quality, can have significant, albeit harder to quantify, financial implications. Careful judgment is required to avoid short-sighted decisions that prioritize immediate cost savings over sustainable organizational health. The correct approach represents best professional practice because it acknowledges the multifaceted nature of leadership effectiveness. Emotionally intelligent leaders are better equipped to understand and manage their own emotions and those of their team members. This leads to improved communication, conflict resolution, and a more supportive work environment. In the context of U.S. healthcare regulations, such as those stemming from the Affordable Care Act, ACA, which emphasizes value-based care and patient outcomes, fostering a positive and engaged workforce is indirectly but critically linked to achieving these goals. High staff morale and retention, driven by effective leadership, contribute to continuity of care, reduced errors, and ultimately, better patient satisfaction and outcomes, which are key metrics in value-based purchasing. Ethical considerations also mandate that leaders treat their staff with respect and foster an environment conducive to professional growth and well-being, aligning with principles of beneficence and non-maleficence towards employees. An incorrect approach that solely focuses on immediate cost reduction by implementing a top-down, directive leadership style without considering staff input or emotional impact fails to recognize the long-term costs associated with high turnover, burnout, and decreased productivity. This can lead to regulatory scrutiny if it results in a decline in quality of care or patient safety, which are overseen by bodies like CMS. Ethically, it violates principles of respect for persons and can create a hostile work environment. Another incorrect approach that prioritizes superficial team-building exercises without addressing underlying systemic issues or the leader's own emotional intelligence development is also flawed. While well-intentioned, Such an approach lacks the depth to create lasting change and may be seen as a superficial attempt to mask deeper leadership deficiencies. This can lead to continued staff dissatisfaction and potential compliance issues if it contributes to a breakdown in effective team functioning, impacting patient care coordination. A third incorrect approach that dismisses the importance of emotional intelligence as a soft skill, and therefore irrelevant to operational efficiency, ignores a growing body of evidence and best practices in organizational psychology and leadership development. This perspective can lead to a failure to invest in leadership training that could prevent costly staff turnover and improve overall organizational performance. From a regulatory standpoint, failing to cultivate effective leadership can indirectly lead to noncompliance with quality reporting requirements and patient safety standards, as these are often influenced by the organizational culture and staff engagement. The professional decision-making process for similar situations should involve a holistic assessment that integrates financial considerations with the impact on human capital and organizational culture. Leaders should actively seek to develop their emotional intelligence, understand the needs and concerns of their staff, and foster an environment of open communication and psychological safety. This involves continuous learning, seeking feedback, and being willing to adapt leadership styles to meet the evolving needs of the organization and its people, all while remaining mindful of regulatory requirements and ethical obligations. Question 18. The performance metrics show a 15% increase in reported incidents of unauthorized access to patient electronic health records over the past quarter. As the Chief Information Security Officer, what is the most appropriate initial step to address this trend? Ensuring compliance with the Health Insurance Portability and Accountability Act, HIPAA. Option A. Defer action until a pattern of malicious intent can be definitively established. Option B. Initiate a comprehensive HIPAA security rule risk assessment to identify vulnerabilities and threats to electronic protected health information, E5. Option C. Immediately implement stricter password policies and mandatory retraining for all staff on data security protocols. Option D. Conduct individual disciplinary reviews for staff members suspected of unauthorized access. The correct answer is B. Initiate a comprehensive HIPAA security rule risk assessment to identify vulnerabilities and threats to electronic protected health information, E5. Explanation. The performance metrics show a concerning trend in patient data breaches, specifically related to unsecured electronic health records, AIR. This scenario is professionally challenging because it directly implicates patient privacy and security, core tenets of healthcare administration and management. Leaders must balance operational efficiency with stringent regulatory compliance, particularly under HIPAA. The challenge lies in identifying the root cause of the breaches and implementing effective, sustainable solutions that prevent future occurrences without unduly hindering necessary data access for patient care. The correct approach involves a comprehensive risk assessment as mandated by HIPAA. This process requires identifying potential threats and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information, E5. It necessitates evaluating the likelihood and impact of such threats and implementing appropriate security measures to mitigate identified risks. This aligns directly with HIPAA security rule, which requires covered entities to conduct a thorough risk analysis and implement reasonable and appropriate security measures. This proactive, systematic approach ensures compliance and demonstrates a commitment to patient data protection, representing best professional practice. An incorrect approach would be to dismiss the breaches as isolated incidents or to focus solely on disciplinary actions against individual staff members without addressing systemic vulnerabilities. This fails to meet HIPAA requirement for a comprehensive risk assessment and the implementation of security safeguards. It also overlooks the potential for widespread impact and the need for organizational-level solutions. Another incorrect approach would be to implement overly restrictive access controls that significantly impede legitimate clinical workflows. While security is paramount, HIPAA also emphasizes the need for appropriate access to ePHI for patient care. Such an approach could lead to patient safety issues and operational inefficiencies, failing to strike the necessary balance. A third incorrect approach would be to rely on outdated security protocols or to assume that existing measures are sufficient without periodic reevaluation. HIPAA mandates ongoing risk management and the adaptation of security measures to evolving threats and technologies. Professionals should approach such situations by initiating a formal risk assessment process. This involves forming a multidisciplinary team, documenting all potential vulnerabilities, assessing the likelihood and impact of breaches, and prioritizing mitigation strategies based on risk level. The decision-making process should be guided by HIPAA security rule, focusing on implementing administrative, physical, and technical safeguards. Regular audits, staff training, and continuous monitoring are crucial components of an effective compliance program. Question 19. The evaluation methodology shows that a healthcare leader is tasked with improving patient flow in a busy hospital department. The leader has identified several potential strategies, but is concerned about the impact of any changes on staff morale and the potential for resistance to new processes. The leader needs to select an approach that not only addresses patient flow, but also fosters a positive and adaptive work environment. Which of the following leadership approaches best aligns with best professional practice in this context? Option A. Implementing a new patient flow system based on best practices identified in industry literature, with minimal staff consultation to ensure rapid deployment and avoid disruption. Option B. Introducing a series of mandatory training sessions on existing patient flow protocols, emphasizing strict adherence to current procedures to maximize efficiency. Option C. Focusing exclusively on technological solutions for patient flow, such as new software, without significant consideration for how staff will adapt or be trained. Option D. Developing a patient flow improvement plan through a collaborative process involving frontline staff, soliciting their input on challenges and potential solutions, and co-creating the implementation strategy. The correct answer is A. Implementing a new patient flow system based on best practices identified in industry literature, with minimal staff consultation to ensure rapid deployment and avoid disruption. Explanation. This scenario presents a professional challenge due to the inherent tension between the need for immediate operational efficiency and the long-term strategic imperative of fostering a culture of innovation and employee engagement. A leader must balance the immediate demands of patient care and resource allocation with the broader responsibility of cultivating an environment where staff feel empowered to contribute ideas and adapt to evolving healthcare landscapes. This requires a nuanced approach that acknowledges the impact of leadership decisions on both current performance and future organizational health. The correct approach represents best professional practice because it prioritizes a collaborative and inclusive leadership style that aligns with modern healthcare management principles. By actively seeking input from frontline staff, a leader demonstrates respect for their expertise and fosters a sense of ownership over proposed changes. This not only improves the likelihood of successful implementation, but also enhances morale and reduces resistance. This approach is ethically sound as it upholds principles of respect for persons and promotes shared decision-making, which are foundational in healthcare leadership. Furthermore, it aligns with regulatory expectations that encourage a culture of continuous improvement and patient safety, often driven by the insights of those directly involved in care delivery. An incorrect approach that focuses solely on top-down directives without engaging staff fails to recognize the value of diverse perspectives. This can lead to poorly conceived strategies that overlook critical operational details or alienate the workforce, ultimately hindering patient care and organizational effectiveness. Ethically, this approach can be seen as disrespectful and disempowering, potentially violating principles of autonomy and dignity for staff. From a regulatory standpoint, it may fall short of requirements for effective quality improvement initiatives that necessitate broad staff involvement. Another incorrect approach that prioritizes immediate cost savings over staff development and well-being is also professionally unsound. While fiscal responsibility is crucial, neglecting the human capital aspect can lead to burnout, high turnover, and a decline in the quality of care. This approach can be ethically problematic as it may prioritize financial metrics over the welfare of employees and, by extension, patients. Regulatory frameworks often emphasize the importance of a competent and engaged workforce for ensuring quality and safety. The professional reasoning process for navigating such situations involves a commitment to ethical leadership, a thorough understanding of the organization's strategic goals, and an appreciation for the impact of leadership decisions on all stakeholders. Professionals should employ a decision-making framework that includes 1. Clearly defining the problem or opportunity. 2. gathering diverse perspectives from relevant parties. 3. Evaluating potential solutions against ethical principles and regulatory requirements. 4. Considering the short-term and long-term consequences of each option. And 5. Selecting and implementing the approach that best balances operational needs with the well-being and engagement of the workforce, thereby fostering a sustainable and high-performing healthcare environment. Question 20. Consider a scenario where a new federal regulation mandates enhanced data security protocols for all electronic health records, (EHR), within 18 months, requiring significant upgrades to existing IT infrastructure and comprehensive staff training on new privacy procedures. The Chief Information Officer, CIO, has presented a detailed plan outlining the necessary technological investments and a phased training schedule. The Chief Executive Officer, CEO, must decide on the best course of action to ensure timely and effective compliance, while minimizing disruption to patient care and operational efficiency. Option A. Allocate immediate resources to procure the necessary IT upgrades and initiate a comprehensive, multimodal staff training program that includes simulations and ongoing competency assessments, while simultaneously forming a cross-departmental task force to monitor implementation progress and address emergent challenges. Option B. Outsource the entire compliance process to a third-party vendor without significant internal oversight, assuming the vendor will manage all aspects of IT upgrades and staff training to meet the regulatory deadline. Option C. Delay the implementation of the IT upgrades until the end of the 18-month compliance period to avoid upfront costs and potential disruption, relying on existing security measures and providing only basic informational sessions to staff. Option D. Implement only the most critical IT upgrades that are absolutely essential for basic data security, deferring less urgent enhancements and providing minimal, one-time training to staff to conserve resources. The correct answer is A. Allocate immediate resources to procure the necessary IT upgrades and initiate a comprehensive, multimodal staff training program that includes simulations and ongoing competency assessments, while simultaneously forming a cross-departmental task force to monitor implementation progress and address emergent challenges. Explanation. This scenario presents a common challenge in healthcare administration, where a new federal mandate directly impacts operational workflows and patient care delivery. The professional challenge lies in balancing compliance with the legislative requirements against the practical realities of resource allocation, staff training, and potential disruption to existing services. Careful judgment is required to ensure that the implementation not only meets the legal obligations, but also upholds the organization's mission of providing high-quality, accessible care. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and stakeholder-inclusive strategy for implementing the new legislation. This involves thorough analysis of the mandate's implications, proactive planning for necessary changes, and robust communication with all affected parties. This aligns with principles of effective leadership and management, ensuring that the organization adapts responsibly and ethically to regulatory changes. Specifically, it adheres to the spirit of the Health Insurance Portability and Accountability Act, HIPAA, by focusing on patient privacy and data security, and the Affordable Care Act, ACA, by aiming to improve care coordination and outcomes, all within the U.S. federal regulatory framework. An incorrect approach that focuses solely on immediate, superficial compliance without considering the broader impact on patient care or staff is professionally unacceptable. This could lead to unintended consequences, such as reduced patient access to services due to rushed implementation or staff burnout from inadequate training and support. Such an approach fails to demonstrate responsible stewardship of resources and a commitment to patient well-being, potentially violating ethical obligations to provide competent care and legal obligations to implement regulations effectively. Another incorrect approach that ignores the legislation due to perceived cost or complexity would be a direct violation of federal law, exposing the organization to significant penalties and reputational damage, and demonstrating a failure in leadership to uphold legal and ethical responsibilities. Professionals should employ a decision-making framework that begins with a comprehensive understanding of the new legislation and its specific requirements. This should be followed by an impact assessment, identifying all affected areas, resources, and personnel. Subsequently, a strategic implementation plan should be developed, incorporating stakeholder input, risk mitigation strategies, and clear timelines. Continuous monitoring and evaluation are crucial to ensure ongoing compliance and to make necessary adjustments. This structured approach ensures that regulatory changes are managed proactively and effectively, minimizing disruption and maximizing positive outcomes for the organization and its patients.